I've been dealing with developmental pediatric physiotherapy for the last nearly 20 years. That you have to ask the child, is this what you want?
How do you work with children of autism?
Child who's not interacting is getting a lesser amount of learning. The brain is just not making sense. That's why movement and alignment what we work.
Thank you, Kirti, for joining us in this very, very special podcast that we call Brain in You.
Thank you.
So, the purpose of this podcast is for us to invite experts like you to help the parents get answers to some very common questions or some common myths that they want to break that they have in their mind and maybe get a sense of hope. So, I will first start by asking, what do you do and what kind of kids do you work with?
I'm a physiotherapist and I am an assistant professor in Ramya Medical College. I've been in the pediatric physiotherapy section and I've been dealing with developmental pediatric physiotherapy for the last nearly 20 years now.
So, what kind of children often come to you?
We see babies right from the day they are born up to adolescence. And so we have a lot of children who have been in the NICU for various reasons. They could have been preterm, or they did not cry after birth, or they had some infection or a brain infection because of which they were in the NICU. And they need to be on a developmental follow-up regularly. Some of them come with already a diagnosed neurological condition like cerebral palsy or spina bifida, or there could be some nerve injuries like brachial plexus, etc. So these children also we follow up, and we follow them up right up to the adolescent age. And we see that, so initially it is more of development. So the first 2 years, the stress is on looking at how are they developing, are they achieving their milestones, etc. And then it's more about how they are dealing with functions that they need to do in their day-to-day life. And finally, the goal is to take them to be a part of the society, how best we can integrate them, or what challenges are they facing in their day-to-day life, and how we can help to overcome them.
So, at what age, how small can a child be for you to understand that he has, let's say, CP?
So early signs, there's something known as risk factors. So we already know certain conditions like baby not crying after birth or baby being excessively preterm predisposes them for acquiring this problem where the brain is getting damaged or getting an insult, as we say, in the first few months or years of life when the brain is still developing. So there are certain signs like there would be a tonal changes. So there could be too floppy or they could be too tight. That's what in parental language, that's what they would say. Either the baby seems very stiff or the baby seems too floppy, not attaining milestones, not getting head control on time, not feeding well also at times. So these are various different issues that they might come with. And then we have certain scales on which we assess them to look at how's their tone, how are their reflexes. So neurological signs that we are able to pick up and their developmental milestones. So we'll take a combination of all these and their development and their birth histories and prenatal histories to put it all together and then say that yes, this child looks like the child is showing early signs of cerebral palsy. So that's clinically. Once we suspect that, then it's a teamwork. So we send them for getting further investigations done for their brain, which will be done by the pediatric neurologist. So we refer them to a developmental pediatrician who would then look at what kind of scans needs to be done for them.
So, you're saying when a child is born,
Yes.
the two signs are if the child doesn't cry or is pretty much preterm.
Or pretty much preterm, yes.
Okay. Yeah. And then the next time what can a parent do at home? What are some signals that a parent can, like a checklist, that a parent can go through and say that if my child is not doing these by this time, then this is definitely something I should maybe get checked for some neuro concern?
So every stage, the child has to achieve certain milestones or certain key milestones, as we call them. So we have children, by 3 months, a child should be having some at least partial control developed in the neck. The baby should be smiling, looking around, should be communicating in at least some response, like a smile to the parent. Moving the limbs around well. By 5 to 6 months, we expect a good rollover. So baby should immediately roll over on the tummy. By about 9 months, the baby should be sitting up well, should be trying to move in some way. So it's called as pre-walking progression. So baby should be moving in some or the other way, maybe creeping on the tummy or trying to crawl or things like that. So like that, for every few months, there is a key milestone in the gross motor. So this is in the gross motor. Similarly, you would have in the fine motor. So there are different components to development. So gross motor is one. Fine motor is using of hands. Social communication is trying to smile, trying to communicate in some way, cooing, babbling with the parent. So all aspects of development are important. So it's not just one, but so many of them. So every time they go to the pediatrician, the best way is that the pediatrician also should ask these two questions to them, and then see if there are concerns that baby has not achieved. Okay, should come in the next month. If not, come back. Let's get it checked.
So how do you define cerebral palsy? Is it also to do with social interaction?
Secondarily, yes. Primary, cerebral palsy has to have some kind of a motor problem. It has to have. It's not purely social communication.
What is a motor problem?
Motor problem means ability to move around. So it could be in the gross motor and fine motor domains. That means all these sitting up, walking, standing.
Chalna, crawl karna.
Yes, ये सब जो है ये सारे gross motor में आते हैं. And fine motor is using of hands.
Okay.
To grasp objects, reach for objects, transfer objects from hand to hand. So all these are fine motor. So motor is a primary thing which will be affected in cerebral palsy.
But ये बहुत late नहीं पता चलता है. मतलब it is not necessary कि एक parent को जल्दी पता चले fine and gross. या फिर वो बचपन में जब बच्चा is trying to hold a ball.
Yes.
जब वो crawl भी नहीं कर रहा but ball को catch कर रहा है.
Yes.
That is what you're saying.
It should be there. Yes. So first thing is always the head holding, गर्दन नहीं पकड़, गर्दन नहीं संभाल रहा है बच्चा. They come to us at like 5-6 months, the baby is still not holding head. That is something that is picked up as the first sign.
Got it.
By parents.
Okay. Eye contact?
Eye contact will be there unless there is a visual issue. So sometimes if the brain involvement is in the area of the visual area in the brain, the occipital area, then we have something known as it is a CVI, that is a visual impairment. Okay, so it is related to the brain. So it's not that something is wrong, it's a cortical visual impairment. So cortical means the part of the brain. And so if they check eyes, there's nothing wrong with the eyes. But the brain is not making sense of what it is. So in such cases, yes, those children also will have difficulty in focusing on objects or on people. Yes, but that's a problem in the brain area being affected. Yes.
Okay. And would you come across children in this, and when you're analyzing a child, not necessarily the same symptoms can also exist for autism?
So in autism, mostly what we would see is a more of a communication and eye contact problem. So it's that not that the child is not able to visually focus on an object, but the child is avoiding eye-to-eye contact. That is something that.
Why does that happen? Why do they not make eye contact?
It's like they are within themselves. They don't know that this is something. So children very early learn to differentiate between living, non-living automatically. It is something that is ingrained in us. But these children who have they are going towards a spectrum, autism spectrum, or have autism, they are just not able to immediately differentiate. So it's like, just like if you're seeing an object, how would you look at it? The same way I would look at a person. So there is no differentiation there. So when I'm looking at a person, I look at the person's eyes. But when I'm looking at an object, I might be looking at any corner of that. So the same thing happens with them, and that's why they are not really looking, because they are not differentiating.
This is very interesting. Okay. Yeah. And how soon are you, as a physiotherapist, able to identify that a child is on spectrum?
So actually, as a diagnosis, people would not want to diagnose till about 18 months, at least 18 months to 2 years of age. But the signs again. So the early signs would be visible as early as 5-6 months
Acha.
of age, because that's when the first engagement with people starts. Like I said, when a child is looking at a face and you're trying to talk to the child is responding. Child is not speaking, but child is responding in some verbal response and trying to imitate what your expressions are. So the child is engaging with you, which is not going to happen in children. So it's not that you have to wait for 2 years and only then say, because it's not a one fine day event. It's been there already. So these subtle signs will be coming.
So what should a parent do? Let's say a parent observed that my child is not smiling back at me and it's been a while. So let's say a child should smile at 4 months or 3 months, but it's been 6 months, 7 months, but the child is really not responding, looking at my face. What should they do, or what can they do at home? Or as soon as a parent feels that, there is a delay, can they do something?
They have to get it assessed.
Okay.
So instead of trying out different things at home, it's always, it is the most essential thing is to first get an assessment done, because from where is this problem coming in? So is there really a visual impairment that could be happening? Could be, that's what it could be, maybe. And if not, then there are other stimulations that the child needs to be done. So take the child immediately to a developmental pediatrician who would look at a lot of other aspects to come to a diagnosis. So it's not just one thing, but there will be multiple things that would be looked at. Like I said, the developmental history of the child, what the child has been through during the time when the baby was in the womb, and immediate post-delivery, and how the development has been. So there are multiple things that would be screened by the developmental pediatrician and then take a call on. So instead of directly going on to starting to therapies or run around doing different things at home or try some remedial things at home, it's better to first get a diagnosis or the first get some screening done.
So let's say diagnosis ho gaya, and let's say the doctor says your child doesn't have a visual concern, but maybe on the spectrum, maybe mildly on the spectrum. So then does the child come to you for physiotherapy for eye coordination, or can the parent do something at home to build eye coordination?
So it is all, yes, of course the parents will work on it, but it's always good to have, then go to a team, to go to a child development center where the physiotherapist, occupational therapist, and the whole team would look at what all can be done for this. So very early, if the babies are very young, we do not expect the parents to come to the therapy center also on a daily basis. But does the child require stimulation daily? Yes, the child does require stimulation daily. So taking a home program and then working on it systematically would be ideal, rather than like again trying
Kya hota
something.
hoga? Matlab, what kind of a home program exists to stimulate eye contact?
So again, it has to be first that you have to be in, going close enough to the baby and using your visual, your touch to first make the baby have some kind of a contact of understanding that this is a person. And then it starts from there.
Okay.
Yes.
So in autism also, do you say that there can be some 3 early signs that a parent can, let's say the child was born on time, he cried, everything else, everything is fine, and maybe eye contact is also there, but is there still some 3 early signs or 3 signs that a parent can identify at home and not wait till 18 months or 2 years? Typically parents wait till 18 months or 2 years or even more. That maybe my child can be a late talker, or I have a shy child. Typically, this is what I hear from parents.
Correct. So see, talking is the last thing that's already, that is a full-blown problem by then. So do not wait till the child is, just that you even realizing that the child has a problem by the time the child is not talking. You've already wasted a lot of precious time. And there are a lot of these signs which are already present, like eye contact or having some kind of an emotional to and fro exchange between the mother and the child, or anybody at home for that matter. So understanding that the child will be able to understand this is my mom, these are my family members, having that discrimination between family members and strangers. So this kind of social development that the child starts. So not having that is one of the early signs. not responding in some kind of a reciprocal verbal tone. So child is not speaking, but child is trying to make certain vocal sounds to respond to your tone when you're talking. Child is engaging with the environment or engaging in a purposeful way. So you are, whatever you're talking about or showing to the child, is the child able to look at that when you're talking about something, or some reciprocal, you're throwing a ball at the baby, or giving something to the baby is trying to reach, give it back to you. Some kind of to and fro, okay, has to be there. Child is not, if the child is not interested in anything, child is peculiarly only looking at their own hands sometimes, or just not having any eye contact, no change in expression when the mother is going near the child, talking to the child, then yes, these are signs of concern, and they should be then dealt with or taken up for a discussion with the pediatrician.
So, Kirti, we have a lot of parents who have children on the spectrum, and one question that they feel victimized about, where mothers feel कि हमसे कुछ हुआ, कि ये हुआ. So, according to research, whatever is available, why does autism happen?
So there's of course a genetic predisposition to like primary autism. It just comes in the genes. Could be genetically inherited, but it could also come spontaneously. There is no reason why it has just come spontaneously. Some of the things which have been researched are could be advanced age of parents, or excessive stress during the period of maternity period, or it could be very early, again prematurity, preterm babies. These are some risk factors, but it all doesn't mean that it has to come for every child who's a preterm is going to develop autism. It's not that. But these are some of the signs or some of the risk factors which have been documented. But the thing is, rather than to know why this has happened, I think the best thing to do for the family is to accept and to move ahead, rather than trying to find the reason or the cause for what led to this. That is in case of primary. Secondary autism can come from environmental factors, which have that the child has been watching too much of screen, there is no interaction, the child is not having any kind of stimulation, means any kind of any communication between the parent and the child happening, or any family members. Everybody is very busy, child is only with a nanny maybe whole day, and not again getting any kind of stimulation, only being left with a mobile phone or a screen. So these can also lead to something today which is known as virtual autism.
तो virtual autism ठीक हो सकता है अगर आप स्क्रीन बंद करो, या आई थिंक पेरेंट्स ऑल्सो डोंट नो, थोड़ा सा इस पे एलैबोरेट करो कि व्हाट इज स्टिमुलेशन.
Yes. So stimulation is that you have to spend time with the baby, talking to the baby, playing with the baby. Just play with the baby. Yeah. And with activities that are age appropriate for the baby. So it's a baby who is a 6-month-old baby. Baby just likes to create sound. So giving things that make sound with the baby, to and fro, you do it, give it back to the baby, see what the baby does again. So this kind of an interaction, sitting face to face and talking with the baby. So those things have to be, and stimulation is always age appropriate. So if it's a 6-month-old baby, there are certain things. As the baby is growing older, you are doing more purposeful activities. Maybe stacking some rings with the baby, throwing a ball. So these activities have to grow, and unless the activity is challenging as per the age of the baby is going to get bored. So
Actually, very interesting. I do come across parents who spend, I think, decades. बच्चा 15 साल का हो जाता है, पर वो 10 साल तक 12 साल तक उसके स्पीच पे काम करते हैं, और स्टिमुलेशन नहीं होता है, मतलब कम्युनिकेशन नहीं है. दे आर जस्ट वेटिंग कि एक दिन स्पीच आएगी. इस प्रोसेस में दे ईदर गिव अप कि इसको कुछ नहीं समझ आ रहा, कोई फ़ायदा नहीं है इससे बात करने का, तो वो बच्चा कुछ नया सीखता ही नहीं है. तो देर इज़ नो स्टिमुलेशन, देर इज़ नथिंग न्यू हैपनिंग इन द ब्रेन. तो आई थिंक जब बच्चा 14-15 साल का होता है तो उसकी समझ एक 5 साल के बच्चे जैसी ही होती है, क्योंकि कुछ लाइक यूर सेइंग एज अप्रोप्रिएट कॉन्वर्सेशन नहीं करोगे तो एंड एवरी टाइम जब आप बात कर रहे हो तो आप उससे बोल रहे हो बोलो मम्मा मम्मा मम्मा. तो एवरी डे वो यही सीख रहा है बस कि बस बोलो मम्मा मम्मा मम्मा, पर उसकी स्पीच नहीं है. बट देर इज अंडरस्टैंडिंग इन लैंग्वेज बीइंग डेवलप्ड.
Yes.
There is communication happening in the head, but
Yes.
the speech
So
is not
that's the
coming
thing,
out.
communication. That is more important. And communication can be taught in different ways. So it's not that you have to stick on to the baby has to say or the child has to say so many words. But some way of communicating, is the baby able to communicate his or her needs to the parent? So it needs to start there first. And what you are communicating is the baby showing with action or showing with some kind of a reciprocal movement or a reciprocal response that the baby has understood what you're saying. So much before expression, it is the understanding or comprehension of language that needs to develop. And using it either verbally or through gestures, the baby has to start. So a lot of non-verbal communication also has to be taught, because otherwise the child is stuck. They don't know how to get their feelings or get their message through to the parent.
और ऐसे में बहुत गुस्सा आता है बच्चे को, बहुत फ्रस्ट्रेशन एंड एजिटेशन, जो काफ़ी पेरेंट्स आके कहते हैं कि बच्चा बहुत ज़्यादा अग्रेसिव है. आई थिंक इट इज़ ऑल्सो टू डू विथ कि वो अपनी बात तो कह नहीं पा रहा.
Exactly.
और देर इज़ नो मीन्स टू कम्युनिकेट. वो अपॉर्चुनिटी उसको दिया ही नहीं. द ओनली अपॉर्चुनिटी ही हैज़ इज कि बोल के बताओ.
करेक्ट.
और वो बोल नहीं पा रहा है.
नहीं.
बट देर इज़ दिस, मतलब मैंने बहुत कम पेरेंट्स से सुना कम्युनिकेशन के बारे में. मैंने सारे पेरेंट्स से सुना स्पीच के बारे में. एंड ऑलमोस्ट 4 लाख बच्चों के साथ हम लोगों ने पेरेंट्स के साथ बात की होगी, काम किया होगा, पर मैंने कभी भी इन दोनों वर्ड्स को में डिफरेंस नहीं नोटिस किया. पेरेंट्स सिर्फ और सिर्फ स्पीच की बात करते हैं.
Yes. So communication is extremely important. See, the baby is also communicating from day one. How is the baby communicating? Baby is crying. It's a communication. Baby learns that, okay, when I cry, I get feed. When I cry, I get a diaper change. When I cry, then somebody puts me to sleep. So that's the only way of communication initially. And slowly it should go on changing. So then the tone in which also the baby would cry for different things. जैसे मम्मी समझती है ना कि अब ये ऐसे रो रहा है, इसको नींद आई है, अब ये ऐसे रो रहा है, इसको खाना चाहिए. So that also, so that's the first changes that we start seeing in communication, and then it is producing different sounds, etc. So if you don't so it's a to and fro thing. So sometimes mothers just know it instinctively that अभी ये टाइम हो गया, इसका ये टाइम है, खाने का टाइम है, सोने का टाइम है, this way. So somewhere along the way, slowly the mothers also, and our speech therapists, when they work with them, they also teach them, and the developmental pediatricians also teach them that you have to ask the child, is this what you want? And show, is this what the child wants? And let the child respond in some way. Wait for the response. So even to get that across to the child, that you can ask in a different way for what you need, and not that every time you just have to cry or you just have to scream if you want something, or just do and then the mother just understands for every she knows what the child wants. So don't let that become habit, because then that's how the baby is also learning, that I do and then I get. I don't have to say, because the mother just knows what to give. But this communication will not work with others. So you ask, even though if you know that, okay, do you want water? Okay, pani, and then you wait. Wait for a response. With communication and with speech, you have to give some time to the baby. So it may not come immediately. So that patience is required to wait for the response. Either the baby would nod or would try to point, or something that the baby would start doing. So this to and fro interaction is something that needs to be then learnt by the parent.
And this is also stimulation.
This is also stimulation, yes.
Yeah. Okay. So when it comes to your role as a pediatric physiotherapist, how do you work with children of autism?
So we work with children with autism in multiple aspects. So one is, of course, where they do have. Typically, as a physiotherapist, we would look at any problems with their gross motor, or any problems in their walking. A lot of them come with toe walking initially, so we work with that as well. So their gait issues. But why is it coming? Is it because of certain sensory hypersensitivities they may be having? So we try to get them down. Sometimes they have already developed tightnesses, so we try to work on both aspects. So working on their gait, balance, and getting them used to or adapt to these different sensations so that they're not agitated with these. And also then getting them into their age appropriate activities, getting them slowly into group sessions to interact with maybe one child at a time over a period of time. Follow some instructions that are given as a group. So we slowly go from one to one and then try to get them to a group activity.
Why, you mentioned this and I've seen it. Why do children walk on their toes who are on the spectrum? I've noticed this.
Yes. So one is we do see a lot of this. So if there is a reason for it, then sometimes it may be a hypersensitivity to tactile stimuli.
Achha.
So what touches their feet, they don't like it. And so we have to desensitize their feet. We do see this a lot in children with who are born preterm also. So we don't really know why again. But initially it just starts as a hypersensitivity issue or some proprioception. So they're not able to really feel, or they want to get into that position to feel normal. So again, getting them down, making them feel what is normal, working on different textures, etc. And sometimes it's just called idiopathic. We don't really know the reason why.
Okay. And some children who are on the spectrum also have concerns with their posture. Why does that happen? Why?
So again, because they are not very aware of their body. Their body awareness may not have developed very well, because they're not moving around in the space same as other children, or they are getting too disturbed by certain stimuli. Could be certain sounds, sometimes what they feel they don't like, or they try to seek certain stimuli, so that they want to feel an excessive vestibular input. So they want to maybe spin around or keep rocking themselves, etc. So they are just trying to get sensation in a different way than what usually children who move around get it. And that's why their postural awareness, their balance, coordinations can also get affected.
And do they have a sense of distance? I mean, let's say they're coming down the stairs. Will they have a sense of how much steps should I put?
So it's not affected in all of them, but some children would have that also involved in them, but not as part of a spectrum that we see that this is affected in everybody.
So I was speaking to another expert, and she said one remarkable thing, that the first thing any parent should do for a child on spectrum is to work with a physiotherapist. Why do you think that is the case?
So it's the body awareness that we start, and the movement in space, movement on their own bodies, getting aware about their own body, and getting the correct sensation. So the first 2 years in a child's development are known as the sensory motor phase. So they are seeking sensations by touching, feeling, mouthing objects, moving around. And the more they move, the more they move, the more sensations they get. So a lot of learning is dependent on that. So a child who's not interacting with the environment is getting a lesser amount of learning, and the brain is just not making sense of what is coming to it. So that's why movement and alignment, proper alignment is what we work on as physios.
So how is OT different from physiotherapy?
So occupational therapists, there are some areas that we work together, like sensory, getting a sensory integration into the child, which are done by both of us. But as physios, we concentrate more on their movement, posture, alignment, strength, etc. While an occupational therapist would work a lot on their hand usage in their day-to-day activities. So looking at exactly what this child needs to do in a day-to-day life, how the child should be eating, how the child should be dressing, undressing. So all these ADLs is what the occupational therapist would work extensively with the child in coordination with the parents as to what this child is not able to do right now and how we can support.
One last thing that I
Yes.
want to know from you. You have worked with a lot of children who have cerebral palsy or autism. Any very special memory that you have of a child who came to you early on and maybe somehow crossed the barriers or in some way, made remarkable progress in CP, let's say?
There have been so many actually. So I've been seeing children for the last 20 years now. So some of them are now adults. And in fact, many of the children who I used to see, and they're still in touch with me. There's one child who's finished his BA. There's another child who's already working. There's one girl who became a clinical psychologist herself.
Okay.
So these are, and they have difficulty in movement, so they use walking aids to move around. They have orthoses that they wear, etc. But they have found a way to be a part of the society
And contribute.
and be self-reliant.
Reliant.
Self-reliant, yes.
So, cerebral palsy and IQ, is it a myth? Is it a misunderstanding that parents have that my child will now be a burden and he can't do anything? Yes, the child cannot move. I also know that some cerebral palsy kids are not as much impacted, so they can move around. But
Yes. So just like autism has a spectrum, cerebral palsy also is a wide range. Okay, so it has range. It has ranges in terms of mobility, in terms of hand function, in terms of again communication. So these abilities are classified. Okay, and it goes from very less affected to quite badly affected or quite over. There's an overall affection to all these aspects. So this is when we assess children, we classify them and we work on them based on those classifications. So children who are at a very low level of mobility, they also tend to have lesser intellectual abilities and a more of a global affection. So for them, yes, they are going to be dependent. Then our goal is to help the parents how to manage these children, because they are going to be completely dependent for their day-to-day mobility, their feeding, everything. That's the most affected ones. But then those who have at least some ability to move around, even though they may be in a wheelchair, at least if they are able to operate their wheelchair, at least they can get a spoon to their mouth. So somebody has to get the meal to them, but at least if the child can be taught to eat by themselves and things like that. So every level also has some ability that can be worked on. Children who need to walk with a walking aid, okay, they will, but as long as the child is trained to walk with a walking aid, that also gives the child some independence. So that's how we work on different levels for each child. So what is best for that child, and that we communicate to the parent. That is something that needs to be done by therapists and parents sitting across and with the team to understand what all can be done. So it's not a lost cause at all. It's a journey. The child is going to have cerebral palsy throughout his life or her life, but there are abilities that we have to keep a watch on, have to develop those abilities to the maximum, and see how the child can be made a part of the society. So we always go from just not working at impairment level, that not just straighten the legs, wear some shoes and things like that, but then we look at functional, how best we can make this child mobile, how best we can make this child participate in their day-to-day activities at home and outside in the community. So that's the ultimate goal that every therapist works towards.
And every parent
and every
wants.
parent also should be having that as a goal as to how best you can make the child participate, and not just that, oh, let this child only walk, or let this child only have a straight posture and things like that. So it doesn't end there.
Do you also work with autistic kids for a longer period? Or do you know of, have you been involved in any of the journeys that they've had?
um, Off and on in between, because there are, like I said, there are these certain aspects that we keep working on, and yes, so many of them are now those with whom we started as small toddlers and babies are now teenagers.
Okay.
Yes. And yes, some of them are doing good. They are, the best thing is that if we are finally able to get the family on board, they have accepted and they are working together. So all of us are working together as a group, so that the child is doing better. So that's the first step and the most important, because unless that acceptance comes, there's nothing that will help the child, because then they are just trying to negate the diagnosis, which cannot happen. We have to work, accept the diagnosis and see how we can help the child to get better, to progress, have goals which are more functional, more achievable. Start with that first, and not just an ultimate, is this going to be all right or not all right? Otherwise, I am not working on this. It doesn't work like that.
And typically I've seen or I've read in autistic children, they're very, very bright. Some of them have this special talent.
Yes, so many children have a peculiar or a particular area in which they would be having very, very excellent kind of abilities. To some of them, their memories are extremely good. They're able to really recite or remember, like say historical dates, or they would be able to remember maybe the periodic table of their mind, just like that. Some are very good at mathematics, some are very good at language in terms of making words. So it varies again from child to child. Yes.
So even there, it's not a lost cause. I mean, to label an autistic child as being low IQ or dumb or a burden.
So it's
not
not no, it's not true. So that is, it's not that autism doesn't mean mental retardation.
Yeah.
That's a different terminology. So again, in every child there will be some abilities that we have to pick up. We have to establish some form of communication. That's important, because that really brings out that anxiety level in the parent and in the child. Once that is established, then it becomes much more easier, I would say.
Wonderful. I think we'll end at that happy note. Anything
Yes.
that I missed you want to add for the parents to know?
Yes, so I think we've covered most of the things, but as parents, yes, keep a watch on your child. Anytime you feel that there is something that disturbs you about the child's behavior or the child's development, do not ignore it. Take the step. Even if just it's that one question that you ask the pediatrician, just do it. Do not hesitate to ask, because the earlier you start working, the better your results are going to be.
Absolutely. I think early intervention is the key, no?
It is the key.
Yeah, that everybody says that. Okay. Thank you, Kirti.
Thank you. It's been a pleasure.
Yeah.